Let's start with our lecture, Acute and Chronic Rhinitis. And in this section, we will talk mainly about acute rhinitis. And when we will talk about acute rhinitis, topics we will mainly cover is the viral rhinitis. Then we will discuss influenzal rhinitis and also rhinitis associated with different exanthemas. First, acute rhinitis. As we already mentioned so many times, the difference between acute and chronic. Acute is short term and chronic is long duration and long term. That is persistent for long duration. And then rhinitis. Rhino is for the nose. Itis is for inflammation. So in this we will mainly talk about the different causative factors and different causes of rhinitis or inflammation of nose or nasal mucosa. So acute rhinitis, short duration, short onset of rhinitis or inflammation of the nose. So first, most important presenting feature is usually, as with any allergies, there are itchy ears and buzzing sounds. Then there are red, itchy, watery eyes are present, sneezing, and then congestion, runny nose is very common presenting feature of rhinitis. There is itchy or sore throat, post-nasal drip and cough. So post-nasal drip, usually patients feel that they are swallowing something from the nose, so they feel there is fluid dripping back in the mouth. So all these are very, very common features of acute rhinitis. Acute rhinitis can be viral rhinitis caused by different viruses. It can be due to different bacteria, and irritative factors can also lead to acute rhinitis. So acute rhinitis is inflammation of the nasal mucosa, and the most common presenting features are usually runny nose, sneezing, cough, sore throat, red, itchy, watery eyes. So all these are very, very common presentations of acute rhinitis. Can be due to viruses, can be bacterial or irritative rhinitis. Viral rhinitis. Viral rhinitis is commonly known as common cold or Coryza. Other term is Coryza. The etiology or causative factors of viral rhinitis, it is mainly caused by viral agent. We need the virus to cause viral rhinitis. The causative agents, usually the viruses, different viruses that can cause viral rhinitis. Commonly we have adenovirus, picornavirus, and subgroups like rhinovirus, Coxsackie and enteric cytopathic human orphan virus. So these are the different viruses that cause viral rhinitis. It is contracted. Viral rhinitis is by the airborne droplets. So if somebody has infection or viral rhinitis, when they cough, when they talk, they spread the causative agent in the air, and then when the next person inhale those air droplets, they can be affected also. So usually patients who have this viral rhinitis, they should, especially in the early days of rhinitis or infection, they should be isolated, and they should be take precautions. They should cover their mouth when they cough or sneeze, so the other persons cannot get this infection. So airborne droplets, it can be transferred from one person to another in the environment. Incubation time. Incubation time is the time from in which the infection occur or the virus reach the body and the onset of the symptoms. That's the incubation period. So 1 to 4 days, and illness lasts for 2 to 3 weeks. Viral infections usually they take time about 2 to 3 weeks, 14 to 21 days, and they usually go on its own. Incubation period is 1 to 4 days. So for the entrance of the virus, from the time virus enters the body and the onset of the symptoms, that's incubation time. That's about 1 to 4 days. So causative agents, viruses, different virus, adenovirus, picornavirus, all these viruses can cause viral rhinitis, and it is transferred by airborne droplets, and incubation period is 1 to 4 days, and usually illness lasts for 2 to 3 weeks. The clinical features of common cold or coryza, how it presents. Usually the secondary invaders. If the person has viral infection, usually they can have secondary invaders, or they can have secondary supervening infection that can affect the person. So usually the secondary invaders are Streptococcus hemolyticus, pneumococcus, Staphylococcus, Haemophilus influenzae, Klebsiella pneumoniae, and Moraxella catarrhalis. All these are different bacteria that can supervene the viral infection, leading to secondary infection, and can further aggravate the condition and can worsen the condition which the patient already have. Burning sensation at the back of nose, all these are the clinical features of common cold or coryza. So there is burning sensation at the back of the nose, which cause nasal stuffiness, rhinorrhea, and sneezing. Rhinorrhea is runny nose. Rhino is nose, rhea is flow. So there is flow of the nose. And then there is initially nasal discharge is watery and profuse, and then become mucopurulent due to secondary bacterial invasion. So it's very important in acute cases, in acute rhinitis, the discharge is watery and profuse. But as the time goes, infection becomes chronic, and when it is superimposed or secondary infection occurs by the bacteria, usually then the discharge becomes thick and mucopurulent discharge as a result of secondary bacterial infection or invasion. So very common, everybody gets common cold, it's common, everybody knows what's the feature of the common cold. They usually have runny nose, watery eyes, redness of the eyes, itchiness at the back of the throat. So all these are very common features of common cold and coryza. But again, condition becomes severe, or it gets worsened when secondary bacterial infection supervenes, and then viral infections usually they need the symptomatic treatment, but when the bacterial infection supervenes and there is also fever and bacterial infection, then usually patients need antibiotic for the treatment. Next, the treatment of coryza. Treatment is bed rest is very essential. Plenty of fluids. Tell the patient to drink plenty of fluids, and they should have a good bed rest. Antihistamines and nasal decongestants, they work really good in patients with common cold. And then analgesics, as I mentioned, symptomatic treatment. If somebody has headache, fever, body aches, analgesics should be given to relieve the pain. And antibiotics, especially if secondary bacterial infection is present, antibiotics are not given for the viral infections. For viral rhinitis and viral infections, usually bed rest, plenty of fluid, and symptomatic treatment like analgesics, Tylenol, acetaminophen, they are the best treatment options for viral rhinitis. Then non-aspirin containing analgesics are preferable as aspirin causes increased shedding of virus. For any rhinitis, viral infections, aspirin is not usually recommended. Non-aspirin analgesics are preferred. In children also, aspirin is avoided because they can cause Rye syndrome, which is a very, very serious condition, and it should be avoided. So best treatment option is usually the acetaminophen, which is available usually as Tylenol in America and Western countries. So this is the treatment option. Complications of viral rhinitis or rhinitis, usually it's self-limiting and resolves spontaneously after 2 to 3 weeks. Occasionally, complications like sinusitis, pharyngitis, tonsillitis, bronchitis, pneumonia, and otitis media develop, and these are more common if there is bacterial infection also present. So sinusitis, tonsillitis, pharyngitis. Here you can see a very good picture of swollen tonsils, and it's tonsillitis with the pussy discharge on top. So tonsillitis can also occur. This is the diagram that shows this is the healthy bronchus and this is the inflamed bronchus if bronchitis develops. So all these are the complications of rhinitis, but usually if it's simple viral rhinitis, the condition resolve on its own within 2 to 3 days, which is about 14 to 21 days, 2 to 3 weeks. Next topic I will talk about is influenzal rhinitis. So as the name shows, it's the rhinitis or inflammation of the nose caused by the influenza. Influenzal, this is the picture of influenza virus. Virus is causative agent of influenzal rhinitis or influenza virus A, B, or C. And these strains of influenza keeps on changing. So if there is vaccination for influenza A, usually other strain of influenza can affect the person. So influenzal rhinitis caused by influenza A, B, or C. Signs and symptoms are similar to common cold. It's influenzal rhinitis. Signs and symptoms, as we mentioned, watery, runny eyes, redness of the eyes. There is itchiness at the back of the throat, and there is runny nose, especially in the beginning. It's watery and profuse, and then later on it becomes mucopurulent. So all these things are common in influenza rhinitis also. Complications due to bacterial invasions, and complications are same. They can cause sinusitis, pharyngitis, bronchitis, tonsillitis, that can all occur with the bacterial invasion on top of the viral infection. Next, rhinitis associated with exanthemas like measles, Rubella and chickenpox are often associated with rhinitis, and measles, mumps, and chickenpox, all these are exanthematous illnesses, infections in which their patient present with rash, and they are also associated with rhinitis. It precedes exanthemas by 2 to 3 days, and usually the patient present with the exanthemas, and then they develop the features of common cold or rhinitis. So 2 to 3 days before before the exanthemas, usually it occurs. Secondary infection and complication are more frequent and severe in the rhinitis which are associated with exanthemas. You can see these are the different type of exanthemas, rashes that can appear, and these are preceded by common cold-like symptoms or by rhinitis about 2 to 3 days before the rash appears. These are the rhinitis associated with exanthemas, in which we have measles, rubella, and chickenpox. So that was all about section 1. Thank you for watching sqadia.com.